Hi, my name is Sumitra Khandelwal. I'm a professor of ophthalmology at Baylor College of Medicine. I have some tips that I give my residents that I'd love to share with you. One tip is that, your attendings in training, they're obviously there for you to learn about clinic, learn about surgical skills, but keep in mind they're also a great opportunity to bounce off ideas about work-life balance, about how they got where they are, and life advice, because they've been in your footsteps and beyond. And you may never get that chance again to talk to mentors like that. Second of all, too, is when I look back at residency, it's incredibly important to realize that it's important to learn the surgical skills and clinical skills, but you're also in a wonderful time of your life. And so it is a great chance to make sure that you maximize opportunities of living in your 20s or 30s or whatever your age, connecting with other people and making sure that you don't burn out during those years of training. Lastly, residents always ask, should I do a fellowship and what type of fellowship? I'm a strong believer that a fellowship really does give you a leg up as far as surgical and clinical training, but it has to be the right decision for you. I ask the residents, okay, if you had to do whatever it is your specialty is going to be every day, the most boring part of that specialty, would you be okay doing that? Maybe it's dry eye, maybe it's floater exams, maybe it's glaucoma suspect. And if you say, I think I'm okay with that, that's great. That may be the field for you. But I also say, if something disastrous in that subspecialty showed up to your clinic at 5 p.m. on Friday, would you be okay with that? And if they say, I don't know if I really want that, then maybe that fellowship is not for them. Personally, for example, we never want to see complications that require urgency to the OR, but in my field in cornea, cataract, I'm okay taking that patient, even if it's after hours in my field. So with that, I would love to encourage all the residents out there to think about the practice that they're going to have, think about what type of fellowship if they want it, but also remember that during these years of training, you're going to learn so much more than just surgical and clinical skills through your mentors.